Hi, I'm Zoe Falster. I'm a senior clinical psychologist in the Older People's Mental Health Service and the psychology head of department for St Vincent's Health Network. A lot of older cohorts aren't necessarily familiar with mental health issues, and is it something that they have been brought up to think about or talk about with other people, so they'll internalise a lot of what's going on for them. I think there's often a perception that they don't want to burden others with their issues, or that their feelings are just a normal part of ageing, which they're absolutely not. We know that most people will go into their 70s, 80s and 90s feeling really good about that and about themselves. So it's absolutely not normal to feel down and depressed just because you're 80. So anxiety and depression are both very normal mood states for most people. Most of us will experience some level of anxiety and depression throughout our lives. But when we talk about clinical anxiety and clinical depression, they become quite different. So essentially they're more pervasive, more profound mood states that affect us kind of throughout the day and start to affect the way that we function and interact with those around us. Clinical anxiety is characterised by really high levels of fear and typically also associated with a lot of avoidance of whatever the feared situation might be, to the degree that it actually stops you from being able to participate in your activities of daily life and interact with your friends and your family in the way that you would like to. Clinical depression is also a really pervasive mood state that, rather than lasting maybe a couple of hours or a day or two, would persist for weeks or months even. And again, the mood state is so low or so depressed that it kind of prevents you from participating in your day-to-day life and interacting with your peers, etc. Typically we know that depression can look a little bit different in older adults. It tends to have a much higher cognitive load and affect attention and concentration quite a bit more than in younger adults. So much so that an older person with depression might have such impaired attention and concentration that it might look like they've got a memory impairment or a dementia. And often we call that a pseudo-dementia, which is a symptom of the depression and absolutely treatable by treatments for depression, but very much sometimes confused with dementia in its own right. So I guess one of the scariest impacts of depression in older adults is the impact that it has on the risk of suicide and self-harm. So we know the rates of completed suicide in older cohorts, particularly men over the age of 85, it's about 40 times higher than in younger cohorts, about 35 per 100,000. I think those rates really emphasise the need to identify depression in older people and respond and take it really seriously, and that goes all the way from family members to GPs all the way to specialist health services like our own. So we know that for generally well people, rates of mental illness actually decrease across the lifespan, generally from around midlife onwards. However, that picture changes a little bit when we take into account things like physical illnesses, situational issues, etc. So in some situations and with some illnesses, we know that the rates of depression and anxiety do increase with older age. And some of those situations might include, for example, living in residential aged care, having a lot of medical comorbidities, suffering a recent bereavement or loss or change in life status. Some of those things can make depression and anxiety more prevalent. So the good news is there's a lot of different treatments for depression and anxiety these days, ranging all the way from medications to lots of talking therapies and lots of complementary therapies as well. There's a range of different antidepressant medications and other medications that can help to take some of the edge off some of the symptoms. There's also a number of different psychological strategies and techniques that a psychologist or a counsellor might be able to go through with you to help you often reverse that lethargy cycle and address some of those perpetuating factors. Our experience of treatment here at the clinic is really good. We get really good outcomes for the vast majority of the people who come to see us, and we typically achieve the best results through a combination of antidepressant medication or a medication for anxiety and talking therapies, so psychological therapies, the most well known of which is cognitive behaviour therapy, but there are a range of other approaches to suit particular circumstances and particular people.